President George H.W. Bush remains in a Houston hospital after a bout with the bug. Local doctors say they've seen a number of specific patients with pneumonia around the River City as well.
And Crystal Chen joins us now. Crystal, what group really needs to know about what's going around?
Well, when I checked in with the care spot on the south side in Duval County, they're saying that it's mainly in the several elderly patients that have been diagnosed with pneumonia. They're being treated with a round of antibiotics, and nurses say if you have it, you'll feel flu-like symptoms like a fever and chills, and doctors usually use an x-ray, a chest x-ray, to diagnose patients. Also, checking with our Duval County sick weather map, we've seen several people as well with the flu, a lot of people still with the common cold, and again, we've had 5 people on social media talking about pneumonia. Now, in Clay County at the care spot in Middleburg, they've had a rise in flu patients. Strep throat has mainly been keeping their clinic, though, extra busy. Now, in St. Johns County at the Healing Arts Urgent Care in St. Augustine, several people have been suffering from flu-like symptoms like congestion, headaches, and coughing, but their tests have actually come back negative for the flu. Their office has also treated a few cases of pneumonia. And in Nassau County at the care spot in Yulee, they've had a steady flow of patients testing positive for the flu. Strep throat, upper respiratory infections, and pneumonia have also been reported. So week after week, doctors treat a lot of patients walking around with a nose that's either stuffy, runny, or all of the above. And sometimes it can be difficult to know whether you're battling a cold virus or a bacterial sinus infection. So one telltale sign is that a sinus infection usually begins with a cold but will take some time to develop.
If you got a viral respiratory tract infection or a cold, if you're not getting better by about 10 days, particularly if your mucus is getting thicker, you're feeling even more run down, then it is probable that you've actually developed a bacterial sinus infection.
Dr. Benninger says the first step to preventing sinus infections is to try to prevent folks from getting a cold. He urges folks who have a cold to make sure they wash their hands if they've touched their nose. Skipping this step can easily contaminate other people. He also says there's growing research that suggests the use of steroid nasal sprays, zinc lozenges, and nasal irrigation systems can greatly reduce the length and the intensity of both sinus infections and colds. Sinus infections differ from colds because they develop from bacteria, and they're often treated with antibiotics. A cold does not always turn into a sinus infection. He recommends waiting 7 to 10 days to see if the cold resolves on its own before seeking out antibiotics.
We really have concerns about this growing antibiotic resistance because we're giving so much unnecessary antibiotics, and a lot of it's for sinus infections. There is this resistance that's developing in the community. It's making it harder and harder for us to treat infections.
All right, keep in mind that you don't necessarily need an antibiotic to cure a sinus infection, but of course, without one, it's going to take a lot longer to feel better.